Senator Debbie Stabenow made history 20 years ago when she became the first woman from Michigan to be elected to the United States Senate. She sits on the influential Senate Finance Committee, where she's the ranking member of the subcommittee on health care and plays a key role in legislation on Social Security, Medicare, and Medicaid. Senator Stabenow, it's great to see you again. I always love our discussions. Today we're talking about all the issues that are on, I call it the stress dashboard of particularly women over 50, but all voters over 50 and how they're looking at it. And that's financial anxiety, it's COVID, it's kids, it's all these issues. But I'd love to kind of get your take on what you think the highest priority concerns of this community are.
Well, Steve, it's always wonderful to have conversations with you, and so appreciate your leadership. You know, there are so many things, I think, on people's minds that are older, and I think right now it starts with COVID, quite frankly. 8 out of 10 deaths so far under COVID, and this is not slowing down. We're seeing a resurgence, as we know. 8 out of 10 deaths have been people over the age of 65. And when I think about my mom, who's 94 and healthy and lives in an apartment, but last spring she said to me, when they were in lockdown and she wasn't able to see any of us or do what she normally did, is this the way the rest of my life is going to look like? Now, it sounded extreme to me thinking about it, but if you're 94, 95, 96, you don't know how much longer you're going to be blessed with. None of us do. And the question of, is this what the rest of my life looks like, I think is very real for her and for her friends. And so healthcare in general is critical. But when we talk about whether or not we're going to have a real federal plan that gets our arms around the COVID crisis, that has rapid testing, that gets a vaccine safely as soon as possible, I think for older people, there's a greater sense of urgency, you know, when you want to see the grandchildren and the great-grandchildren, in my mother's case. Healthcare more broadly certainly is. And again, I will speak through the lens of my mom, who keeps asking me why in the world would the President of the United States want to eliminate healthcare through the ACA, or why do our Republican colleagues keep trying to do that? And so I think healthcare, and what we saw through the Affordable Care Act, where the rating system was different, so seniors were proportionately not paying as much, where we see prescription drugs covered, pre-existing conditions. Of course, as we get older, we all have more what would be viewed as pre-existing conditions, and all of the other issues that relate to, you know, Medicare, doing a free annual wellness check, and so on. So healthcare broadly, incredibly important. And when we look at, again, the president's proposed cuts, I think this last budget he proposed over $1.6 trillion in cuts in Medicare and Medicaid. And that looks at things like nursing homes and assisted living and all the other long-term care kinds of things. So healthcare, I think is very much at the top of the list.
Senator, I want to get into some legislation you're proposing, but before I do that, I want to let our viewers know that you've been one of the real leaders on mental health. And so one of the questions, we have Francis Suarez, you know, the mayor of Miami, who will be on our second band, and he and I have talked a lot about the stress of these times and what it's doing to people, the subterranean conflicts. You and Senator Roy Blunt have done a lot on mental health care support, but I'm just interested, is this sort of, you know, part of the picture of concern that you have? And I know you've been working on stuff that's sort of toe in the door in terms of support, but we rarely talk about mental health in these times, and I'm just wondering how much we should be talking about it.
Well, Steve, we should be talking about it a lot, and thank you for raising this. And Senator Blunt and I have been wonderful partners on this. It really is a bipartisan effort, and we are moving across the country now to establish fully funded community behavioral health centers, like we have health centers with the same kind of insurance coverage and Medicaid coverage and so on. And we've got 10 states now fully engaged, and we're moving this across the country, and excited about what potentially we can do next year to get it to get the centers all across the country. But you talk about the stresses that have added to even more of a concern. There's a couple of things. One, for people already receiving mental health or trying to receive mental health or substance abuse services, which we combined call behavioral health. For those individuals, in a time when everything is being shut down, that becomes even more difficult. I was able in the CARES Act to make sure that behavioral health was included for telemedicine, but it's very difficult still to try to reach people to try to do these things. So those currently getting treatment are in a more difficult situation because of COVID. And then we add all of the other issues now of stress, starting with people in a healthcare settings. When I talk to doctors and nurses who tell me they literally feel they have PTSD because of what has been happening, the stresses they see, what they're trying to do, the overwhelming sense, of trying to save lives and loss. So there's incredible pressure there. And then for everyone else, everything from loss of job to a sense of isolation. And again, back to an older person, someone in a nursing home, someone who's in a situation where they've not been able to really see anyone for months and months. It creates depression in a different kind of way. And so I've been very concerned as we go forward in any COVID package that we understand the traditional stresses and treatment that's needed, but that we've added a whole nother category, not counting children and young people, and try to work our way through this. As you know, I always say we need to provide healthcare above the neck as well as healthcare below the neck. When you're talking about comprehensive healthcare, it's the brain, it's our emotions as well as everything else.
Thank you for that. I think it's so important what you've done, and it's amazing. One of the things I've been sort of doing a deep dive on, like, what's the state of Americans, particularly, across these different age bands. And one of the kind of harsh realities, and this is my own editorial view, is that you turn 50 and things get more fragile. You might get laid off earlier than someone in an earlier generation. There's an ageism that's sort of built out there. And when you then begin looking at the anxieties, financial, but healthcare and others, and I know you've been trying to address some of that anxiety and these inclusion questions with the Medicare at 50 Act, and would love our viewers to hear what this would give that category of American an opportunity to participate in.
Well, thank you, Steve. I really believe we need to lower the age of Medicare. We can do that in a way that keeps traditional Medicare and the funding and structure in place, and add basically an option, a buy-in, using the current tax credits and other funding in the Affordable Care Act and so on, to create a separate pool. So it doesn't undercut in any way traditional Medicare at age 65, but would create an option for someone at 50 or 55 or 60. We can debate what the number is. I believe it makes sense to say 50, but somewhere in that range, and allow people to buy in to that. We know they can get a lower cost. There have been multiple studies showing 30% or more reduction in costs for people. But here's what we also know. You mentioned the anxiety, feeling more frail. We also have people in jobs that are required to retire in their 50s. And I know folks, that it's, my own brother said he was holding his breath till he got to 65. There's a lot of people in that category. There's a lot of people who put off preventative care that's going to cost them money, things that would be covered under Medicare, but they put it off, and then it becomes more serious, so that by the time they get to 65, it costs Medicare more money because they weren't doing the preventative things that they could have done if they had done that at age 50 or 55. We know that people, once you reach age 50, that you are more likely to use more healthcare. And so there's a number of reasons why we, in my judgment, should be lowering the age, creating that pool where it's an option for people who don't have good private insurance, they don't feel they have what they need, to be able to buy into a system that would be lower cost and more comprehensive for them. And in the long run, it would save the entire healthcare system money.
And that would save, in fact, because they would be buying in, they would be bringing money in, so this isn't necessarily more government outlay. So I guess my question to you, friendly question, is who would be against that?
Well, the same people that are trying to do away with the Affordable Care Act. I mean, honestly, the same people who, and I don't know why it's a partisan divide on healthcare, because, to me, healthcare is personal, not political. But ever since there was Medicare, look at who voted for Medicare and who opposed it. It was a Democratic proposal voted against by Republicans. Ever since then, it seems like we try to make steps forward and there's always pushback. So I think it's really fundamentally comes down to how you view healthcare. Is it a right or a privilege? And by right, I mean, is it something that, all of us need, and therefore we should be creating a system that's cost efficient and comprehensive for people? My Republican colleagues would basically say, they say repeal and replace. They don't have a replace. But what they really, in the back of their minds, what they really mean is let the insurance companies determine the rates, go buy it in the private.
We may have just lost Senator Stabenow. I don't know if we're going to reconnect. Producers, are we going to reconnect? Look, I want to thank Senator Debbie Stabenow. I had another question launched up for her, but it was quite a fascinating discussion. Her legislation is called the Medicare at 50 Act. It would allow Americans to buy into this program, and we were just discussing the political dimensions of it. So I want to thank Senator Stabenow very much for joining us today and for her thoughtful responses to these questions.